So now we'll have the last presentation before the coffee break. And I think it was a dark February evening when Daniela and Valeria and me discussed how to create this ESIO program. And we thought it's necessary to have as much perspective on this topic as possible. And I think the most important perspective is a patient story. And then I think, I have to admit that I was a little bit nervous because I thought we have one patient we'd like to present here. I discussed with Valeria, she agreed within a second, and this is Petra Winkler. And so please come in front. Yeah, I asked you where during the consultation, and I was absolutely astonished that you agreed within 2 minutes, because I know it's always the big challenge to talk in front of doctors and nurses. And thank you, Petra, that you share your story with us. We know each other since 1.5 years, but your story is much longer.
Good afternoon, everyone. I hope you all had a good day so far. I'm very happy to be here and share my story with you. I'm Petra Winkler-Hirter. I'm 47 years old. I have a husband, or I'm married, and I have a 12-year-old daughter. I was born in Switzerland, lived in Sydney for 13 years, then moved to Munich, lived there for 6 years, and came back to Switzerland at the end of 22. I have been a health practitioner for more than 20 years. I started as a medical massage therapist working in rehabilitation. I'm also a craniosacral therapist. I'm an Iyengar yoga teacher. And currently, I'm just about to finish my training to be a yoga therapist for breast health and breast cancer. But today, I'm speaking as a patient and as a yoga practitioner. I'm gonna share with you my personal cancer story and how I discovered what I can contribute to my own health and well-being. Let's go back to 2016. At the end of 2016, I was just about to move to Munich. I was diagnosed with a HER2 breast cancer. They couldn't find the primary, but I already had metastasis in most of my bone metastasis in most of my trunk. So we moved to Munich. I was still looking pretty healthy. So I started with lots of tests and examinations and meeting a few different doctors until I found my oncologist, Dr. Holzhauer. He treated me for the next 6 years. My health rapidly deteriorated. I started to get a lot of back pain. I started my therapy with paclitaxel, pertuzumab, and trastuzumab. But then in a scan, they found out how bad the state of my spine actually was. So here you see, oops. Can you see? Here you see my spine and lots of bones lots of holes in my spine. And someone said to me, your spine looks like it's crumbling. And I actually shrank by 7 centimeters. And on the right-hand side here, you see myself and my daughter. And at this stage, I had lots of complications. I had a port infection. The port had to be removed. Then the infection spread into my shoulder joint. So I had a shoulder surgery. And then they also realized that I was allergic to the pain medication I had been taking. So after that, I was just weighing 42 kilograms. So I had to go to hospital as an inpatient because of the state of my spine. And they were pretty surprised to see all my yoga props in my hospital room. And the medical staff was pretty surprised to see almost the whole yoga studio set up in a hospital room. Here you see a picture, and you might not look like yoga to you, but this is yoga therapy. And I will tell you more about that a bit later. But this yoga therapy, daily yoga therapy, helped me really to get through my pain. And it helped me mentally and physically to get through that very hard time. In July 17, things started to look brighter. The treatment worked. I could smile again. And actually also see the corsage I had to wear. Oops. Here you can also see the corsage I had to wear to stabilize my spine. So I could switch from a surviving stage to a living stage. I was able to attend my daughter's first day of school, and I was also able to go to a yoga retreat with a long-time yoga teacher from Australia and catch up with some yoga friends from around the world. And this was for me mentally a very important point. And of course, my treatment still continued. And things were going well. Then in May 2019, I had my first seizure. Even after a week in hospital, they couldn't find any cause. I had 2 more seizures before they actually found that my cancer had spread into the brain. So here you see one of my tumors. And I had 2 brain surgeries. They couldn't get everything out in the first one, so I had a second one a week later, where luckily everything could be removed. And things were pretty hard. Like, it was a really hard time for myself to recover from that. And the tumor board decided I should continue with my first-line treatment. And my health had been stable since. I still have the occasional seizure, which is due to my scar tissue. And of course, I still have my 3-weekly cancer treatment. And I started passing on my experience, my knowledge to other cancer patients. At the end of 22, we moved back to Switzerland. And I found my oncologist, Dr. Hübenthal. But let me tell you a bit more about my yoga practice. First, I want to introduce you to this person, BKS Iyengar. He was the person who brought yoga to the West in the early 60s. And this is one of his quotes that's very close to my heart. Yoga teaches us to cure what needs not to be endured, and to endure what cannot be cured. So, when you're diagnosed, your body is in a state of emergency. Its immune system, it tries to fend off an intruder. It operates under extreme stress. This is leading to exhaustion and fatigue. Equally, the diagnosis, it pulls the rug from under your feet. Mentally and more emotionally, you're in a downward spiral, which is very hard to control. Yoga helps me to stop this spiral and come to the present moment. Yoga means taking time for myself, to come to myself and to look after myself. And you have seen a few poses now. They're restorative yoga poses, which are done in an acute phase of the cancer, during chemotherapy, during radiotherapy, post-surgery. They would just be individually adapted to the person's need. So you can let go, you can open up, and you can quieten your mind. The postures aim to bring energy into the body without using energy to do so. Imagine this hand. There are the pins, that's my cancer. So when you're diagnosed, you get scared. You want to hide in a cave. You get really tight. The pins are still there. And you close that fist. The pain might get even worse. With yoga, I can open up. I can let go. The cancer is still there. But it doesn't hurt as much. And that's what yoga does to me. I want to mention a few very important people to me who have influenced me, who have supported me to come to this point. Most of all, Stephanie Quirk from Sydney. She's a yoga therapist who studied and lived in India directly with BKS Iyengar for more than 20 years, assisting in his therapy classes, learning from him. And she now travels the world and shares her experience. And I was fortunate enough to assist in her therapy classes for a couple of years during my time in Sydney. And there is also Lois Steinberg from the US and Rita Keller from Cologne, they both have written quite a few books. They both studied with BKS Iyengar for more than 40 years. And there is also Kerstin Kattab. She is a cardiologist from Pfaffikon, and she's also a yoga teacher and yoga therapist and runs classes in Pfaffikon and Zurich. And I think some of you or most of you would know Holger Kramer, who has done lots of research into yoga and cancer and other complementary therapies. And this brings us to the end. Here you have my digital contacts, but do you have any questions?
You're impressive.
What did you do about your bones? Because that are very special positions in the yoga position. How do you preserve it? Or ich glaube, ich würde mich hier trauen, sowas zu
You
machen.
have seen one arch. And actually, that's one of the props I took with me to the clinic. And I was in so much pain, I couldn't, when I got out of bed, I couldn't stand straight. To go to bed, I had trouble to lie down. And during my time in the hospital, I had so much time during radiation. So I moved from the flat part, almost centimeter by centimeter, over 4 hours until I was almost straight. And because I could go that slow, I wasn't in pain. And I still don't take any pain medication now.
I have two short questions. How did the doctors react? Because you showed us only all the tools you brought, but looking at you doing this with knowing your MRI spine scans must have come to some doctors' minds that you shouldn't do that.
They were skeptic in the beginning, but because they also, after a while, they realized how much straighter I could actually stand up. And from that point, they actually just accepted what I did. And they didn't see everything I did. Luckily.
Any other question? How about breath? What would you say? Because I saw you in these positions in the asanas, but how important was for you breath control or breathing exercises to get over the pain?
In the Iyengar yoga setting, I mean, you do pranayama in a much later state. But when you go through the asanas and you observe the asanas, each asana has actually a different breath. So some of the poses, you actually breathe more up here. Some of the poses, like the bridge you saw, it makes a very long breath, but very small. So actually, you don't talk that much about the breath. You let the patients, the person you work with, you let them come to themselves first and just observe the breath. Because when you observe your breath, it already changes.
Mm-hmm.
But you don't want them just to kind of force their breath. You wanted the breath to let go.
Mm-hmm.
And you can try it out. Do a turn with a chair or something, and your breath changes. You might actually, when you do a turn, your breath is more on the one side, it's more in the back, and on the other side, it's more on the front. And that's what you use actually the asanas for, to then be able to go into the pranayamas. So you actually already have that awareness and opening to actually get that breath into the body.
Another short question. How often do you practice yoga and in what kind of intensity? Like how many minutes or...
Looking at my husband. I practice every day for 2 hours. I do 2 hours of asana and I do half an hour of pranayama. In a normal setting, like today, I didn't have that much time, but I do at least 2-3 poses, which might be 15 minutes, half an hour.
What do you recommend to other cancer patients who wants to also to practice yoga or start with yoga?
I mean, I do personal classes now, just one-on-one settings. And the first 2 classes, I don't recommend anything. After a while, they have bolsters at home. I show them a few things. And it would be the best if they could practice at least every day or every second day, every third day. It makes a difference if they already do once a week. If they haven't done any yoga, they feel an effect. After a while, if you do one day a week, you don't get that much effect. You need three a week, I would say, to get to that point again.
Okay, thank you.
Petra, great lecture, great presentation. I'm interested in the pain sensation. What's your experience if somebody would start out with yoga based on trying to reduce pain? How long would it take until he or she feels an effect? Because feeling an effect motivates you to keep doing this. What's your experience? How much time would somebody need from the beginning to feel pain reduction effect?
I mean, we use all those props. I mean, in the beginning, especially like post-surgery, they might not be able to spread their arms out. So you support the arm with the hand to the breast, which is already quite nice for those women to actually get that energy into their heart. But you also support the arm. And we worked in a hospital here with Petra in Essen during my hospitation. And we worked with acute patients. And they did little things like just mudras and even just lifting their arms up to here or wherever they could get them to. And even just concentrating, observing the breath, just supporting with a pillow under the chest, something that could already work.
So, I think there are many questions. Probably they can be discussed in the coffee break now. Petra, thank you very much. It was an overwhelming, very, very interesting presentation.
Thank you.